and welcome to another episode of Your Public Health Professional and You, a program of the Maryland Public Health Association. I am Lillian Abegbe, your friendly community health educator. I'm excited to be talking to another public health professional working in the state of Maryland for your own health outcomes. Today, I'm talking to none other than Suparna Navale. She is president of the Maryland Public Health Association and, of course, a practicing public health professional in the state of Maryland. Suparna, let's get to meet you. Can you tell us who you are, a little bit about your background?
Sure. Hi, welcome everyone. So as Lillian was saying, I am Suparna Navale. I currently am a full-time research analyst at OCHIN. We're a nonprofit organization that works with community health centers to install their Epic EHR systems. And because of that, we have access to millions of patients across the country that are low income or under-resourced patients. And because of the access to that data, we can do research. And so we work with at least 50 or 60 different partners throughout the years. And I'm currently working on about 4 projects right now, studying the patients and figuring out what's going on. And so I do research, I pull data from the EHR systems, and I love data, so that's what I do. And in my spare time, whenever I have that, I also am an adjunct professor at Temple University, teaching biostatistics at the undergraduate and graduate levels. And then again, in my spare time, I love volunteering and working with the Maryland Public Health Association, as well as the American Public Health Association.
Oh my goodness, that is so interesting. I got goosebumps thinking at biostatistics for something to do in one's spare time. You think in your spare time you want to go mountain climbing or something. But there's a lot you said there, and we're going to unpack it because, hey, we're trying to understand who the public health practitioners are. So I heard a research analyst, and I'm thinking somebody is saying, hey, I live in Prince George's County, I live in Montgomery County. What have you got to do with me as a public health practitioner? And because you're saying public, and so I'm thinking that has something to do with me. So how does your work as a research analyst benefit the average person that you might never run into?
Yes, of course. So because we are working with the clinicians at the ground level and have access to data, we are able to look at every part of you. So both the medical side as well as the social determinants of health, where you live, where you eat, where you work, and how all that kind of comes together. And, because of all the data that we have, we can run some certain models and try to figure out what's really going on in the community as well as the larger state and even nationally. But at the local level, we're able to find out, due to the research that we do, how we can better serve you and how the clinicians and the physicians that you're working with can better serve you in taking care of your health. And that's really what a research analyst does, is that, we might sit at a computer for about, 8 to 10 hours a day. But what we're really trying to do is find information, find scientific evidence proving ways to actually help you and the health of you and your family as well.
So you are getting all of this data, you're working with physicians, you're finding data that says, where people live matters in how they're responding to healthcare or whether they have access to healthcare. And so somebody living in some county might find that a policy has changed based on your findings, or the services being provided for them at their healthcare center has changed based on your findings. Is that correct?
That is very true. And because the community health centers we're working with are funded by CMS, by the Centers for Medicare and Medicaid Services, if there's any policies that are coming across that either restrict access to care or actually provide more access to care, we do see that, how that affects the patients that go to these community health centers and the type of services and access to care that patients have at the local level. So yes, that is very true.
So when we're saying access to care, we're saying somebody is sick and they want to go to a hospital, and you're saying that this data can determine whether they're advocating for either more hospitals or providing maybe free transportation or transportation assistance for them, or maybe making sure that there's language translation available in their healthcare. That's the sort of thing.
Yes, that is so very true. Yes, so we're able to see, and because of all the data that we have, we're able to see both at the patient level and also at the community health center level, what kind of services they're able to provide for their patients. We do have some Planned Parenthoods. So we did see with the Dobbs decision how that has affected the access to care for patients in certain states as well. In Maryland, we're very lucky here due to the access for care, abortion and any kind of reproductive health care that we have here, but other states weren't so lucky. And as you were saying, Lillian, with access to transportation, yes, we do look at that. We do have access to neighborhood level data as to how well patients, or even if you're not a patient of the community health center, how well residents of that county or city are able to get transportation to and from any kind of healthcare facility. So we do have access to all that. And with all this information, it's a big puzzle. The way that I think of data, it's a giant puzzle. And you really have to find all these little pieces, put them together, and get a beautiful picture at the end of how we can really take care of everyone and their health.
Awesome. So your healthcare centers don't just magically appear. When you go and you're able to access the service today, and it wasn't there last year, there's an improved transportation network. It didn't just happen out of the blue. It's because research analysts are looking at the data and saying who's coming, who's not coming, who's living where, who has challenges, and this is how your public health practitioners are working for your interest, even though you may not come across them. When you go to the hospital, you will see the physician, you will see the nurses, but the data analysis that was done behind the scene has implications for how they are serving you so that you can be healthy. That is such awesome for sharing that. Thank you for sharing that insight with us. And then you said in your spare time, you teach biostatistics. I'm thinking public health biostatistics. Well, that's one of the things I like about public health, the diversity of it, really. But the students you're teaching are public health programs, correct?
Yes, they are.
Yes. And so how is this biostatistics? I took classes in biostatistics, I know, but I want our community members to know that how does biostatistics help the average public health practitioner to do their work effectively?
Sure. So because of all the data, so what I try to teach my students, and so I have both undergraduate and graduate. So those that are just new to the public health field and those that are like, yes, I love public health, I want to continue forward. I mean, granted, these courses are required for their curriculum, but what I try to do is show them how the importance of this and how even if you don't use or do any kind of direct data analysis in your future, how it's important for you to have some understanding of it. And so I try to explain, we do some basic calculations in the undergraduate course, but also explaining how to collect data depending on the research question you're trying to answer, as well as the population that you're trying to study. And so by having a very strong understanding of what type of data, where the data are coming from, you're able to analyze that data. And then you're able to, with the results of that data, explain it to both the lay and the expert populations. So even if you don't have a degree in biostatistics, so it's perfectly fine, not everyone does, but what I do is I try to teach the students how to explain it to someone. And when I was doing my PhD, my advisor had always told me, if you're not able to explain your research to your grandmother and have her understand it, then do you really understand what your research is doing? So I kind of put that same thought in my students' mind. I'm like, would your grandmother, your grandfather, or someone that is a little older that doesn't understand the topic, will they be able to understand what these numbers say? And that's what we try to do, get that evidence and try to explain it in the simplest terms that anyone can understand what's going on. And unfortunately, due to the pandemic, I don't know if I'm allowed to talk about this, Lillian, but misinformation There was a lot of misinformation that occurred during the pandemic. The numbers that the biostatistics and epidemiologists provided, it was misconstrued, and that has really hurt our field. And so what we try to do is explain, that's why I keep trying to tell my students, and even those that aren't my students, that we need to be able to explain. That's part of the communication that we have to do as public health professionals, is explain the most complicated topics in a way that anybody can understand it and not misinterpret what those results are.
Awesome. I like that. And it's good that you brought in the pandemic, because yes, we had to do a lot of work during that pandemic. I remember there was some controversy about, somebody had some negative outcome from taking a vaccine that was in the trial stage. And first, it was a trial stage. Secondly, it wasn't in the United States, and it hadn't been approved. And so these are all the things that, data is very important for our work. It tells us that. So if you are saying, hey, this place is a food desert, and there's obesity in the community, we're able to show that by the number of people who are overweight coming seeking healthcare and the distance people have to travel to get healthy food. So that is really important. The work that biostatisticians do, the work that epidemiologists do, implications for how we advocate, because you can't just go to politicians and say, give us more money, or make seatbelts compulsory, make nutritional facts required, and all of those things. We're able to do that because the data says so, correct?
Correct. Yes, data is very important. That scientific evidence is very important for any kind of policies. And as I said before, we can give numbers to everybody, but if the politicians don't understand what those numbers truly mean and how they affect their constituents, they're not going to be able to help. So really the way I think of public health is it's everything, right? As you were saying, Lillian, it's everything, and the work that we do, we might not think that it's affecting, larger policies or larger populations, but really it does. Because, as a researcher, we try to publish results everywhere we can, in scientific journals. And we try to hope that at least one person reads it, and that one article that, they can take something and the doctors will be able to implement something new for their patients or learn something new about their patients, or a politician or someone in politics or policy reads this and says, oh, this one study found something, maybe we should provide more money towards that field, right? Because a lot of the grant money does come from the government. And that's what we try to do as much as we can, but, we really do need more advocates to really push for the public health agenda out there.
Awesome. And we need more advocates, but the advocates need the data to be able to do the work. Correct. So we need biostatisticians, epidemiologists. You may not see them on the streets, they're working behind the scenes. And that's why the public health practitioners, the health educators, and the advocates are able to do their work, because we have the data that has been collected. And you talked about when you were doing your doctoral program. So there was a time when Suparna was a student. And so tell me, and now you are teaching students, undergrad and graduate students. What is the path to public health? Did you wake up thinking, did you know from high school, elementary school, you wanted to be a public health practitioner? Or how did you get here?
Yeah, no, so I actually didn't even know what public health was. Until my maybe 2 years after I graduated from my undergrad. I've always loved math and science. Absolutely loved it. Huge nerd, and I take pride in that. And so I actually went and got my undergraduate degree in biomedical engineering. And so I was like, okay, let me do biomedical engineering. It was more mechanical engineering, working on artificial hearts for the pediatric population. And I wanted to become a medical doctor. Studied for the MCATs, did well, but I was like, I liked patient care, but I liked research more. So I was like, research, that's what I want to do. But I didn't know what I wanted to do research in. And so I am fortunate enough that my family is from India. And I went and volunteered there for a summer. at a cancer prevention center that actually does prevention in smaller villages outside of Bangalore, which is the city that my family is from. And what they do is they actually they take a giant bus and they go and do cancer screenings and health screenings for in the villages. And they do education in the language that we speak about cancer prevention and health prevention. And I was like, this is really interesting. They collect data, but I was like, this is really interesting that they do all this. And then I also worked at a dental college, and they also do a lot of patient education there for the lower income patients. And I was like, I really like this kind of work. How can I do something like that? And so one of my family members, she had a master's in public health, and she was like, why don't you think about doing an MPH? I'm like, what's that? Looked it up, and I was like, public health. Okay, that's nice. And then I saw epidemiology, and just because math and science and epidemiology, that's what it is. And I fell in love. Went and got my MPH at Eastern Virginia Medical School down in Norfolk. Worked at the health department there as a emergency planning assistant. So actually, when H1N1 came out, I was actually working at the health department. So I got very much involved with planning the vaccination clinics for that. And I love that. And so, program planning, getting people to come and get the vaccination, and working with different sectors in public health, and in the health department too, like the firefighters, the policemen, public works, and pretty much getting everyone together to provide these free vaccinations and education to the community members. And so I did that, and then I was doing some research with the professor, and I was like, I've always been, having that doctor in front of your name is always nice. How can I do that? So I actually went on and I applied for a PhD program in epidemiology. Went to University of Louisville, started that program. Unfortunately, my chair decided to retire after about 1.5 years of me being there. And I was like, okay. And he was like, either you can choose to continue on, but getting a different chair and changing your topic, or you can just get the master's. And I was like, all right, let me get the master's. And I went on to a different university in Ohio, Kent State, started my PhD there. And it was a very long journey, but there was a lot of things that happened along the way. I started working at the Cleveland Clinic, teaching epidemiology to medical students that had to take it for part of their program. I started, teaching as a research assistant at the university at Kent State. And then I was like, I want to do research, and I want to, get a job that I actually do data analysis. And then I started working at Case Western Reserve University in Cleveland, doing data analysis on large databases. And that's really where I fell in love with just big data. And that's a hot topic. But, I worked there for 6 years, absolutely loved it. Just recently finished my PhD in December. It was a long journey, but very happy and proud of myself for sticking to it and working full time throughout it. And then eventually I decided that I don't want to be in academia anymore. Most PhDs want to go and teach. At that point, I was like, I want to do more research. I want to get more experience. And so I actually went and started working in the federal sector. I did government consulting with the VA, doing research on burn pit victims in overseas. And I just loved helping others with their own research. That's really what my main passions is. I have my own research interests, but I want to be able to provide you with the data that you need to help your project move forward, or to help the patients and your clients get the care that they need. And so I did that, and then after that, ended up working at Ocean, a nonprofit, helping the lower income and the lower resource individuals.
If you just listen to Suparna and how her path went from interest in math and science to volunteering, going back home in India, where her parents are from, to going out in the field collecting data, and you said, oh my goodness, I didn't know that there's this much opportunity and flexibility in public health, and you decide that public health is for you. Give credit to the Maryland Public Health Association and to this program, your public health professional and you, where you learned about, the diversity of public health, the opportunity it provides. She's worked with government, she's worked in the healthcare sector, and she's teaching and taking all of that passion and really looking out for the interest of others. So you don't have to stay in engineering, you don't have to stay in accounting, and by all means go to those professions if that will work for you. But also look at the opportunity that public health offers you in terms of diversity, to be passionate. I'm sure you could hear the passion in her narrative, to be passionate about the work that she did. Big data, to say, I want to do data, and to say, I want to give this information to people who would use it. That was such, I was thinking, oh my goodness, I should change to public health. And then I realized I'm already a public health practitioner, so I'm in the right place. Thank you so much for that. And talking about public health and being in the right place, you are president of the Maryland Public Health Association, which is a collective of public health practitioners in the state of Maryland. So tell me, how did you join the association and how did you become president?
My master's program, my MPH, the university actually paid for me to become a member of the American Public Health Association, which is the larger association of public health professionals in the United States. And so I was like, I don't know what this is. It's a professional organization of public health professionals. I'm new to public health. Let me go learn more. I went to one of their annual meetings, which is like 10,000 individuals. It's a huge conference, very large. But, I found some other students that had the same passion. And I've always, I might not seem like an introvert, but I am. I'm an ambivert, though. When I need to be extroverted, I will. And so I actually brought that part out in me, of me wanting to be in leadership. So I grew in the ranks and, started, reviewing abstracts for the conference, then started getting into leadership, planning larger events. Just for the students that were a part of the American Public Health Association, there's about 6,000 students that are a part of the APHA. And so I actually grew in the ranks for that and, got to be the chair of the student assembly. And throughout that, APHA has always encouraged us to be part of the affiliates. And the affiliates are there's affiliates in every single state. And they're state organizations, state public health organizations that are associated with APHA, but they are their own organization. And so every state that I went to, so I was first in Virginia, then in Kentucky, and then Ohio, and then now I'm living in Maryland, I became a part of each one because public health happens at the local level. That's really where it happens. And I, just loving just being the camaraderie of others that are in the public health field. Granted, they might not all be epidemiologists or biostatisticians, but we all have that passion for public health and providing resources and a community of public health professionals. And so in Maryland, I saw the opportunity to become president-elect. And, thanks to everyone that voted, I became the president-elect. And, in the first year, I was in charge of organizing all our programming. So we have National Public Health Week, which is always that first full week in April. That is presidential declaration. And we do activities we try to do activities every single day, but APHA, the larger organization, has activities or webinars or some form of activities that they do. And what we do in MdPHA is provide more local activities. So more things, more webinars, more opportunities to network with public health professionals in Maryland. And so that's really where I found my place. And I would encourage all of you to become a member of MdPHA. It's a very nominal fee to be a part of it, but we are a very, very passionate group of public health professionals in all sectors with all different career paths that all found our way here. We do have networking opportunities. As I said, we have our annual event that is coming up at the end of November. We have a great lineup of speakers. So the theme is actually restoring trust in public health. The public health really took a huge hit during the pandemic, but we're trying to get that trust back in public health. So we have 3 speakers lined up. We have the president of APHA coming to speak to us. We also have Secretary of Health Laura Herrera-Scott, who's Secretary of Health for the state of Maryland. And then we also have a local health commissioner coming to speak as well. So we have different levels. It's a great opportunity for you all to come and meet us, the board members, as well as other members of MdPHA. We are huge in students. I've always been an advocate for students. I was a student for a very, very long time. And so we have an initiative of creating chapters of MdPHA at different universities. Right now, we have 4 student chapters. They're predominantly around Baltimore, but we're trying to get it across different universities. So if you're a student listening to this and you're interested in starting a chapter of MdPHA, please reach out to us. We'd be happy to bring you on. We have plenty of free swag that we can send your way, but there's also a lot of networking and mentoring opportunities that you'll be able to find in MdPHA as well. And we do a lot of advocacy. Our advocacy session is in Maryland is from January through April. Our advocacy committee is very strong. They're constantly working, trying to find ways to support more public health bills. We have now gotten a grant with the Energy Foundation, which I'm sure you've heard about. And so we're very big in the climate and health space now. So if any of these things interest you, please join us. We're happy to get you involved in any way possible to provide you with, more education, more opportunities, anything that you need.
So awesome. So many things there, but remember, we're big in the climate space, so you can connect with us. Joining the Maryland Public Health Association is really cheap. Annual fees are very low, and there are tremendous benefits. We're encouraging students to start chapters in your institution, so come on board and find where you can fit in. I wanted to quickly linger on something you said about, restoring trust in public health. What would that look like if trust in public health is restored? How do you see it? What would we be able to point to as indicators that trust has been restored in public health?
That's a very good question. I've had colleagues that were actually health directors at health departments across the country, and a lot of them, unfortunately, had to leave their jobs because they were getting threatened. Their lives were getting threatened. They had to leave their jobs because of the pandemic and all the misinformation out there. People just didn't feel safe in their jobs. And so what I feel would be a good indicator for restoring trust in public health is if, the news media and social media, if they were able to take the data and actually listen to the words that public health professionals are using and not change anything, using their exact words, or maybe changing it to, sound better, but not actually changing the facts, just listening to the facts and reporting on the facts and, trusting, really that one word, restoring trusting that those that are in this field know what they're doing. That's really what I would love to see.
Awesome. I like, one of the things I talk about when I talk about restoring trust in public health, I say we are the same people that advocated for seatbelts. I don't see anybody saying, who are these people telling us we need to wear seatbelts? We're the same people who talk about speed limits, we talk about nutritional facts. And everybody goes to the store and you pick up that product. If there's nutritional facts, you want to read and see, what does this contain? Because you're trying to watch your weight. We're the same people who advocate for parks so that you can exercise. And, we're like, okay, we need fresh food market somewhere. And people listen. And we're able to do all of that advocacy because we collect the data. We've established a relationship between a behavior and an outcome, and we're saying that this is what needs to be modified. So I think it was early last year where the legal age for tobacco was raised to 21. It's the public health professionals. That's why people don't smoke anywhere and everywhere, because not only are there consequences of first-hand smoking, but second-hand smoking and even third-hand smoking has implications for health outcomes. So it's the data that we've collected that has enabled us to make this advocacy where there's restriction on where on alcohol consumption, on where tobacco companies can advertise. And we've done all of that work. And you trusted us. We were looking out for your best interest. So when we talk about social isolation, it's actually based on the evidence from the data that epidemiologists have collected. When we talk about wearing face mask and distance, that it's all based on data that are epidemiologists have collected. And when we talk about vaccines, we work closely. There are clinical trials. We follow those processes. We don't roll out anything, or we hold industries that intersect with public health accountable. We don't leave the pharmaceutical industry to itself, they police themselves, but we're also policing them. So there's a lot of work that public health does to make sure that our public is safe, and we've done it for a very long time. We didn't just become a profession during the time of COVID. We've been doing it, and we've been in the public, we've been in the midst of our community members. So this isn't something new. So I'm really glad to see that, working on restoring trust, because we're the same people that people have almost always trusted. I mean, the only time I think I've experienced some pushback in public health was, when Mayor Bloomberg was trying to deal with supersized soda in New York. I know there was some pushback, mandatory HIV testing. I know there's some, but for the most part, people have embraced our policies, and our communities are safer for it. Wouldn't you say so?
I would say so. And the one thing is that we're not trying to scare you into changing your behavior. We're trying to provide you with the information you need to make a more educated decision. We're not trying to push our policies or anything upon you, or, different behaviors. We're trying to provide you with enough information for you to make an informed decision. I'm hoping it's a good decision, a decision that we would like you to make. But I would say that, yes, Lillian, everything you've said is correct.
Awesome. So I know you said about some professionals that left the field during the time, and that's one of the things that we've suffered, a reduction in workforce. So what will be your advice to somebody who's just going to school, or somebody who's already in the work profession but might be looking for a career change? What will be your pitch for considering public health as a profession?
It's everywhere. You don't have to be in the healthcare field to be a public health professional. There are large national organizations that now all have a health wing or a health department or health related department, should I say, not a health department, but have, some kind of, whether it be a risk management, that's still public health. There's those that are about really what I'm trying to say is public health is everywhere, and it's not just one particular thing. For students out there, keep that passion. You're interested in public health, keep going towards it. There will be jobs for you no matter what. It doesn't have to be in the industry the job title might not just say public health researcher or public health professional. There are job descriptions out there that you can use your skills, regardless if you're a late career changer or early career changer. There are positions and there's a career out there for you. Just find your passion, what you're really passionate about, and just follow that.
Awesome. Thank you so much. This has been another exciting episode of Your Public Health Professional and You. And before we sign off, I want to give you the opportunity. Anything you wanted to say that I didn't get round to asking, and you think that's important to share before you sign off?
No, I think I've said everything. I mean, feel free to reach out to MdPHA, come to our annual event. We do also partner with the Pennsylvania and the Delaware Public Health Associations to host a tri-state meeting. And Maryland is hosting that this year. It's a virtual event, but it'll be in the spring. So I'm hoping that you all will come out for that or, attend it. But, please come out for any opportunities or networking opportunities. We do tend to have socials every now and then, but please just come get involved. Come say hi to us if you see us out in public. We don't bite.
No, we don't. And we're out in the community. If you want us to table at your event, mdpha.org. You can find us on the web. You can get information and email us, and we will respond. And we look forward to seeing you on another episode of Your Public Health Professional and You. Thank you for joining us. I am Lillian Agbegbe, your friendly community health educator. Looking forward to seeing you some other time. Thank you.